am a laryngologist. That's a specific type of ENT that deals primarily with voice, airway, and swallowing disorders.
Okay. And you're affiliated with?
So I work at ENT and Allergy Associates, and I'm affiliated with Mount Sinai and Montefiore.
Great, great. And Dr. McGIntee and you also see the same patients? Do you share patients?
We do only by referral. So
I see.
she's an allergist and I'm an ear, nose, and throat doctor. And so if she feels that it's appropriate that someone needs an evaluation of their upper airway in close detail, she'll send a patient over to me and I'll assess whether or not that's something that falls into my purview.
Gotcha. Okay.
Okay. Well, when we spoke to Dr. McGIntee, she mentioned that she had sent you a couple of patients and that both she and you noticed some similarities and that many of these patients came from, they were swimmers and had been swimming in the same pool in East Hampton.
Yeah.
Can you talk a little bit about what you saw? And
Sure. They tended to be younger patients, both boys and girls. What struck me was really the same symptoms heard over and over and over again.
Which were what? I'm sorry.
So basically, they would go into the pool and they would start having increasing breathing difficulties, coughing, and choking while they're swimming, which is not a usual thing for a young, healthy individual.
Right.
So ultimately, this sort of resonated with her, and she was curious as to whether or not this was involving both the lower airways and the upper airways. And even when taken out of that environment for a short time, the symptoms would persist. And this obviously is bothersome to the child, but certainly worrisome to parents, friends, colleagues, and I'm sure to their coaches as well. And so we're sort of trying to get to the bottom of it, and we've seen a fair number of patients with these symptoms.
You guys discussed you were going to write a paper. You're talking. Did I hear that right? You guys were interested in.
Well, we were discussing at least putting
Your thoughts.
our thoughts together because our fields are very different. Hers comes from a more lower airway perspective, and then of course she's obviously concerned about the nose and the whole aerodigestive tract, and that sort of falls together, and we have different approaches to that. And in medicine, we always look for common sets of patients, common symptoms, common denominators to sort of come together and say, well, does this represent a syndrome, or does it represent a conglomeration of symptoms that may represent something that we can manage collectively and impart that wisdom on for other people to benefit from.
Nice. That's a good idea.
Mm-hmm.
Yeah.
talk a little bit more, if you would, about the paradoxical vocal fold dysfunction and what you know about it and what you think is causing, what science thinks is causing.
Well, it's a very challenging disorder. Basically, it goes by, first of all, the first thing that's challenging about it is different people call it different things, okay? And so one of the things is that's heard all the time is vocal cord dysfunction, paradoxical vocal fold movement, or paradoxical vocal fold dysfunction. It all falls under this category of abnormal movement of the vocal folds that impairs respiration. So in other words, at the top of our breathing apparatus is a valve. It happens to be that we use it for speaking, but it turns out that its primary focus was actually intended to prevent the lower airways from having something affected, whether it be food, a solid substance, liquid like water that would end up in the lung, or gas. And so the bottom line is that the body's defense mechanism is to close the vocal folds when a threat is presented. So our thought is that there are different degrees of laryngospasm, and there are different situations, such as in severe reflux or during aspiration, a person can go into laryngospasm. But in this particular case, paradoxical vocal fold dysfunction, actually what's happening is during intense exercise, the vocal folds close, narrows the aperture of the airways. And when the airways are narrowed, essentially what happens is that the patients feel like they can't breathe. They start making very noisy breathing, what sounds like wheezing. It's actually not wheezing, it's called stridor. And it's a noise, typically on inspiration, but also can be on expiration, when breathing in, not breathing out. And that's the difference between that and wheezing.
And there are organic causes, but then there are also inorganic or outside causes.
I think the bottom line is we don't understand it very well. We know what the symptoms are, and we know what types of people get them, but we don't really understand exactly what is the problem. Why do we have this disconnect between perception of threat and actual threat? You know what I mean? And there's a disconnect between the brain saying, I should close down my airway, and there really being a threat.
The kids that you treated, how did you treat them, and what's happened to them since then? Do you know? Or?
Well, a lot of them are normal, healthy children. And so when you take them out of a certain environment, they don't have the symptoms. To me, I'm a pretty simple person. If you've got a correlation between, say for instance, it hurts when I touch this, don't touch it. You know, it's the same kind of idea, but it's not tough to tell somebody who's young and likes to swim. And it shouldn't be an issue that they should have for the rest of their lives. But it happened to be that it was in particular circumstances. So despite us trying to speak with certain individuals to try to get some of the conditions changed, it became very challenging because obviously there's a cost factor and there are probably other factors that I don't know about. But what I would say is that the vast majority of them ended up being put on reflux medications because a lot of the compounds that became in contact with, as they touch water and become hydrolyzed, they actually, the material actually becomes an acidic compound that irritates the throat. And when that happens, prompts closure of the vocal folds.
So that the chloramines would cause that to shut, probably.
Yeah, chlorine subproducts and byproducts in general.
Yeah, right.
Yeah, exactly. As they are inhaling those things and they touch the water surface of the surface of the mucosa, which is filled with water, as that happens, it actually turns to hydrochloric acid and hypochlorous acid. So you're talking about an actual tissue reaction that causes damage onto the larynx. And the larynx is the voice box. And so when that happens, these patients end up with symptoms. So oftentimes I would treat them with reflux medicines, even though they're not primarily having reflux. It allows them to end up in a situation where their voice boxes are not primed for this problem to make a real effect. And sometimes it works and other times it doesn't.
So some of the kids were able to keep swimming with the reflux and be able to, and then others just had
It
to give
also
up
depends on the
swimming.
day. We typically would find as the doors were opened during the summers, as there was more ventilation, they were okay. When they would go to other places, they were okay, relatively. But there were times during the winters especially, and as I understand that maybe during peak season for swimming, that's a problem. And it was repeatedly the problem in the same location. And without changing some sort of factor about their environment, there's no improving that condition. Even going through the usual routes of treating paradoxical vocal fold dysfunction, such as respiratory retraining through voice therapy, which is what we typically recommend.
Wow. It's pretty interesting.
Fascinating.
Yeah, it is.
Sad.
It is sad, yeah.
Well, it's
And it
frustrating,
doesn't mean
yeah.
that they shouldn't ever have an opportunity to do these things. It doesn't mean that it should prohibit them from doing it. However, it does mean that we have to be more mindful as a society of what products we're exposing our children and ourselves to in these environments. Because clearly we're having a body reaction. This is not something that they're making up. This is real science. And it's been documented in our literature about exposure to chlorine gases, obviously that in large chemical spills and other things, and we've had the onset of these problems that exist not only in these circumstances, but also outside the circumstances. But you know, this is something that we really want to pay attention to because all of our young athletes and children deserve a chance to do whatever they want.
Yeah. What harm comes to the voice box if they keep exercising in that? Is it?
It's a difficult question to answer. I don't know that there's been enough study to look at a longitudinal study over time to figure out whether or not there's long-term damage. But we know what happens if you chronically have acid exposure on the voice box. That's hoarseness, trouble swallowing. It ends up, and potentially it's been linked to laryngeal and esophageal cancer, other things. Now, I'm not suggesting that these children are gonna end up with these things, but we have to recognize that we're having a tissue reaction and a real body reaction. You're actually activating the body's innate response to
Right.
close the airway down. So there's something going on.
Absolutely.
And I think maybe the steps on our end is we need to better understand that.
Mhm.
Great.
Any other questions?
No, I'm just still in my mind spinning about
Yeah.
it. Yeah, no, it's a very,
Yeah, I mean, I've
It's
looked
good,
into this a
yeah.
lot because of the population, especially around this area, that we've had a real hotbed of activity for that particular issue.
for how long, would you say? How many years?
As long as I've been in practice here, the
How long
last
is that?
3 years in this
Last 3
area,
years.
sure.
Mm.
And I'll tell you, I've had exposure personally to high levels of cleaning products and whatnot in enclosed pool environments, and I'll tell you, it's very noxious.
Mm.
Where
Yeah.
you walk into an
Your eyes
environment,
are
you start
burning.
coughing, your eyes are burning. Yeah, exactly.
Yeah.
That's not a typical thing,
No.
and it shouldn't be, because there are other options out there.
Right,
Right?
right, yeah, absolutely,
I
absolutely.
think that's more in your purview than mine, but I would
Absolutely,
say, you
yes,
know.
and I won't get going on that. But I always look at it as my body's defense mechanisms coming into play. It's telling me, "Ow, my eyes are burning, my lungs hurt, it's hard to breathe in here." It's telling me to get out.
Right.
Would you not agree? So
Absolutely.
if they're saying leave and I'm going to go
Yeah.
exercise in it, there's something wrong with that whole mentality. And that's what I have an issue with there too. I think
Agreed.
it's
And there are other body reactions that happen, eyes burning, eyes running, nose, in the
Sinus.
nose and the sinuses, exactly. There have been problems with sinusitis and continual infections and congestion that happens,
Right.
necessitating medical therapy and even surgery in young people
Hmm.
that ordinarily wouldn't have that. And when
Right.
you look at certain disease patterns that you see in swimmers more than you see in other athletes, such as asthma and other reactive airway disease, that's been shown in the literature to have higher incidences of upper and lower respiratory diseases in swimmers than in other individuals,
Wow.
other athletes,
Wow.
with similar levels of activity. Sure.
Fascinating. Let's,
Yeah, that's
love to get our hands on some of that research.
Yeah, there's a whole lot of it out there.
Really?
So when you
Wow.
really look into it, it's something I think that needs more understanding. We don't understand exactly what factors are there. But you have to figure that if your body's trying to tell you something.
right, exactly.
You're
Yeah,
coughing and you're choking.
you can't breathe.
Right.
Something's wrong.
Something's
Yeah,
going on. And we need to understand it better,
Right.
right, and do something about it.
Well, yeah, if you can prevent it from happening, obviously that's the way to go about it.
Sure.
And that's kind of what we wanted to talk to you about and figure out. That's great.
Good. Well, thank you very much
You're welcome.
for spending some time with us
Yeah.
and
You're
enlightening
welcome.
us
Sure, my pleasure.
and
Yeah,
treating
Anything I
our
can
children.
help. Yeah, absolutely, thank you.
Yeah,
Thanks
thanks
for
for help
having me.
tonight.